Good day, everyone. My name is Ibrahim Hamed Orelope. I'm here this morning to take you NSC 5 to 6, which is Perioperative Nursing. Please follow me. I promise you that this course will be interactive. Now, my course description is in order to manage a patient who requires surgery, it requires a unique, unified, and cooperation among the healthcare system, and which is called the surgical team. They need to work together in order to achieve the patient goal. The surgical teams, they work together in an environment, good environment, including primary health care. The preventive nurse play very important roles in order to achieve this setting. And by making them an essential team, all students must be introduced to the highly specialized field of preventive nursing. Now, this is my course objective. At the end of this program, at the end of this course, you should be able to describe what preventive nursing is all about. You're able to discuss the surgical patients and their needs. You're able to discuss the process, the principles, and practice of infection control in the theater. Also, you should be able to describe the theater or surgical environments. You should be able to describe the theater or surgical instruments, discuss the basic roles of the nurse in a preventive environment or preventive nursing. Also, you should be able to describe the type of nursing procedures within the preventive team. You should be able to describe the surgical patients and their needs. Describe basic skills in caring for surgical patients and their needs. At the same time, you should be able to describe the central sterilizing unit and its roles in infection control. Now, I'll go by introduction. As I said earlier on, that preventive nursing is one of the specialty in nursing that comprises all the total care given to patients in the pre-operative environment, intraoperative environment, and post-operative environment. What did I mean? All the total care given to patient before the surgery, that's what we mean by pre-operative environment. The care given to the patient during the surgery, that is intraoperative care or environment. And the post-operative, the care given to patient immediately after the surgery till the patient is being discharged home, is called the post-operative care. Now, the components of preoperative nursing. As it was said earlier on, preoperative phase, intraoperative phase, and postoperative phase. It was explained just now that preoperative phase is the total phase, is the phase, all the care you render to a patient before the surgery. The moment the patient is being announced that this patient is to undergo a surgical procedure, till the patient enters the operating room and on the operating table. All the care that you are rendering during those times is called the preoperative phase. Now, intraoperative phase, all the care, moment the patient enters the operating room, operating table, the moment the procedure is being started till the patient is out of the table and being admitted in post-anesthetic care unit, which is PACO. All this care rendered are called intraoperative care during intraoperative phase. Lastly is post-operative phase. This begin immediately the patient is out of theater, which means that post-anesthetic care unit is part of post-operative phase. All the care you are rendering to your patient during this time till the illness of the wound, surgical wound takes place. All these phases are called post-operative phase. Now, what are we trying to do? I told you earlier on that patient that's been announced to undergo a surgical procedure. I would like to take you through surgery. What does surgery mean? Surgery is a surgical procedure performed on a patient in order to remove, underline this word, in order to remove, repair, or replace any damaged part of the body, or performed to manage patient's current ailments. Surgery can be done to remove any diseased part of the body, can be done to repair any ailment or replace any damaged part of the body. At the same time, it can also be done as a diagnostic procedure to confirm what this patient is undergoing. Now, we have different types of surgery. Surgery can be grouped into three main groups. Number one is surgery can be grouped according to the purpose, the reasons why they are doing the surgery. It can also be grouped according to the degree of urgency. Also, lastly, it can be grouped according to the degree of risk, how important it is, that is, how emergent this condition is. Now, surgical setting. What does surgical setting means? As a surgical procedure will be done in a particular environment, which is operating theater. So this operating theater has its own design, how it must look like, how it must be. It's not just anywhere that, okay, can we do this procedure in our office? No. It's have a particular area that this can be done. Now, how does this area being arranged? It's called the cost settings. Now, the areas that you need to be conversant of, number one, in a surgical setting is unrestricted area. Unrestricted area. This is an area, it's just like an entrance to any surgical suite, whereby people can go in and out of the surgical suite or surgical environment. At the same time, this is where personnel, equipment, and patient will pass in to the theater and out of the theater. In this area, either staff, patients, or anything, you can wear your external attire, external clothes like shoe, your clothes, and anything, you can put them on in this unrestricted area. Now, there has to be a demarcation in the theater called a red line. Before you now move from unrestricted area to another area, there will be a demarcation that's telling you that there's a caution, something needs to change. Now, before you now move from unrestricted area to another area, which is called semi-restricted area, you need to change. Is that your footwear? Now, in this area, it provides for access to procedure rooms. From this area, this is where you now enter to procedure room with some other peripheral support areas within the surgical environment. And the last one is restricted area. This restricted area, this is where the surgical procedure is being performed. It also contains some other sub areas like scrub up rooms where the surgical teams will wash their hands, surgically wash their hand before the procedure is being carried out. And the next one I would like to take you here is what surgical team is all about. Surgical team, as I said earlier on, that before a surgery can be done, it's required a unified cooperation among the health team, surgical team. Now, I would like to mention these few ones here. The number one on my list here is scrub nurse. It's one of the surgical team. The number next is circulating nurse. Now, another one is registered nurse first assistant. Now, the surgeon. The patient is also part of the surgical team. Don't forget, without the patient, none of these members will be available there. Now, the anesthesiologist or anesthetist. Is it the same thing? We also have nurse anesthetist too. Now, the next one is surgical technologist. Now, all these people mentioned, all these team members mentioned, must be present before a surgical procedure could be carried on. Now, surgical instruments. We cannot go away. There's no procedure can be done without an instrument. Now, I would like to group my instruments into groups. SAPs. Now, number one grouping here is SAPs. What do I mean by the word SAPs? SAPs are instruments that contain a very sharp ends, business ends that can be made, that is used for either penetrating or cutting of the patient, skin or body. It can be used in making incisions and like that. And examples of such instruments are surgical knife or surgical blade. Another example is scissors, surgical scissors. We have diatomic scissors. We have assistant scissors, which is medicine bomb scissors, like that. So all these are examples of sharps, including needle. Needle can mix to make a little holes on the patient. So they are examples of sharps. Other instrument types here I have with me is hemostat. What does hemostat mean? Hemostat are a group of instruments that are made in arresting bleeders. An example of instrument that is under these types we have artery faucet. Artery faucet is an example of hemostat. During this particular surgery called cesarean section, there's an instrument called green hermitage. Green hermitage is also meant for arresting bleeders on the uterus. Now, another one is clamps. It's a general names of instrument under clamps. What does this mean? They are instruments that are used in holding soft tissues. For example, now if they are doing resection and anastomosis, they use clamps in holding gut in position before they start their suturing intraoperatively. Now, another one is grasper. They're using grasping tough tissues. An example of instruments that are used in grasping tough tissues are Coca's tissue forceps, Alice tissue forceps, and Babcock tissue forceps, and like that. These are examples of graspers. Now, the next one is retractors or expositors. Retractors are instruments that are used in exposition. Is used in looking into a depth in order to be able to walk inside a depth. So, used to expose so that you'll be able to see what is in down. Now, the next one, an example of retractors are Duyens retractor, Lakenberg retractors, right angle retractors, and the likes. An example, the next one is a position instrument. And apposition instruments are instruments that are used in bringing edges of wounds together for healing to take place. Any tissue that have been cut, these ones are the ones that are used in bringing the edges together. And examples of instruments under this group is needle holder. Needle holder is an example of instrument under apposition instruments. Now the next one I would like to take us is surgical incisions. There are some little selected surgical incisions. We cannot run away from if we want to do cesarean section now. What type of incision are we going for? So all this thing you need to be covered for it on it. You as a preoperative nurse, you need to know more about this. Now I like to just go through few ones here. Number one incision with me here is collar incision. Collar incisions are meant for thyroidectomy, which is removal of thyroid glands. Any diseased thyroid gland, if you want to remove it, they use collar incision on the neck. So another incision here is sternal split. Sternal from the word sternum. If you want to work in the thoracic cage, let's say you want to do any cardiac procedure, you do sternal split. The next one is lateral thoracotomy. Lateral thoracotomy, the lateral, it could be the left lateral, it could be the right lateral. Can be used to assess the thoracic cage as well. If you want to do any cardiac procedure, this two can also be used based on the patient's condition. That's it might be different from sternal split. The next one is right subcostal. Sometimes they call it coca incision. So you can use to assess the gallbladder or the biliary procedures. Now, the next one here is McBurney incision. McBurney incision is meant for appendectomy. It can be used to remove the appendix, diseased appendix. So McBurney incision can be used. The next one is lower midline or midline lower abdominal. This can be used to assess any organs below the umbilicus. So you can use to assess the uterus, use to assess the urinary bladder. Usually, if you want to do cesarean section using lower midline, they can use this kind of incision. Now, the next one is right or left oblique. Can be used for hernia repair or groin exploration. And why the last on my list here is phanesty. Phanesty incision can also be used to assess the uterus. Can be used to assess the tubes, and can also be used to assess the ovary. You know, if they want to do cesarean section, they don't want to use lower midline, you can use phanesty. It's very, very important. Now, I would like to take us to position in during surgery. There's no way you want to operate a patient that will not be in a particular position, and you need to know. If they tell you the patient is undergoing cesarean section, you need to know the type of position you have to put your patient. And at the same time, all the gadgets that you need in putting your patient in a comfortable position for the planned procedure to take place is very, very important. The normal procedure here in my list is supine position. In supine position, here the patient will lay down with their back on the operating table while they will face up. If they want to work on the abdomen, like cesarean section, exploratory laparotomy, they use this kind of position. The next one here is prone position. The patient will just lay down with their face facing down the operating table. They can use the one to assess the spine. If you want to do spine surgery or those type of surgery, we use that. The next one is Trendelenburg position. This time Trendelenburg position, the patient will just the distal part of the patient, which is the lower limbs. So the lower limbs will be raised above the upper limb. The reverse Trendelenburg as well, the upper part of the body, which is the proximal part, be raised above the lower limbs. So lithotomy position here, you know, the patient will flex two legs now to assess the perineal area. If you want to do corporaphy, episiotomy repair, DNC dilatation and curettage, the patient is positioned in this kind of type of position. Now the next one is modified Fowler position. Meaning I have to be in a sitting position here for the procedure to take place. The next one is jackknife position, and like that. Now I'd like to conclude here. The purpose of this course is to introduce nursing students to the fundamental of preoperative care. So that any nurses that have it in mind to specialize in preoperative nursing, they have the baseline and what it takes. So they will be able to know all the care that's needed for patient before, during, after surgery. Thank you, and God bless you. If you have any questions, don't fail to relate to me in the comment box. I will be right there for you. You can drop to my email and like that. I hope you will enjoy the topics. If you have any questions or clarifications, just let me know. Thank you, and God bless you.